Hi viewers, welcome back. In today's video, we are going to talk about POSDCORB. Okay, so POSDCORB is nothing but it is the management process, the overall management process where it is abbreviated and given. So the person who has given this abbreviation is Luther Gulick. Okay, so according to him, POSDCORB is the consolidation of all the management process, the overall management process. Okay, so where we have planning, organization, staffing, directing, coordinating, reporting and budgeting. So planning, so what is planning? So planning in management is usually done by the top level managerial level. So the top level people, they start planning about the requirement or the what's thing has to be done. So the exact planning, what has to be done, who has to do, all these things must be done by the top level people. So you know top level people who are there in the top level people, board of directors, chairperson, executive members, all those people are there in the top level. So who are going to give a plan. So according to their plan, they have a given overall plan. So other than that, you will have individual planning. So the middle level management people, they will have a plan how this work will be organized and given. Then comes the low level management plan, how it has to go and it has to be conveyed to the employees. So everybody will have their individual planning to achieve the single target or the single goal. And then we have organization. So when we come to organization, whatever plan we have done, it has to go in a sequence. So it has to go in a way how the level of communication has to be maintained. So we have seen when you have a communication style, it is like always the principal or the director at the top level management. Then we have the vice principals or the medical officers or the chief medical officer will be there, and then coming to the HODs, okay, different department HODs will be there. Then comes the professors, then the associate professors, assistant professors, tutors, all will be there. Okay, so this is the way how they are going to communicate. So your organization will work. So from your low level, your communication will be going to the top level management. So that is your organization style of working. And then comes the staffing pattern. Okay, so staffing. So imagine when you are placing staffs, so staffs have to be according to the need. Okay, in case when you are placing staffs in the ward, it is 10:1 patient. So in case it is like the workload is going to be very less in the ward, then it is 20 or 25:1. And in case if you are placing staffs in the ICUs, then it is like 1:1. Emergencies 1:1. So that is like according to the area where the staffing has to be placed more and less, that has to be decided, and accordingly you will place the staffs. Okay, so in case if there is less amount of staffs where the workload is going to be very heavy, you will not have stability of workers. Okay, so you will have a constant rotation, they will not stay back, you have to recruit staffs again and again. Okay, where the workload is going to be heavy. So staffing you have to see where you will have good qualified really working, hard working, smart working people you have to place. So your staffing role has to be adequately done. And then your directing, who has to do what type of job. So directing the way or directing where the work has to be done, who has to do all these things has to be given properly. So direction has to be provided properly so that without any deviation the work is done and the target is achieved. So that is your directing area. And then come the coordinating area. Coordinating area in the sense the top level people reaches the middle level people, and from the middle level people it reaches the low management level, from low management level it reaches the employee. So in case if there is any grievances, if there is any problems, if there is any needs, how it has to come. So again from the employees it will come to the supervisory level, from the supervisory level to the middle level management, from middle level management it will be reaching the top level management. So that is the way of communication they have to follow. So that is your coordination has to be adequately done. So in case if there is any problem, that can be rectified now and then. Then we have reporting. So when there is a problem, that has to be done. Your pulse oximeters are not working, your X-ray machines are not working, so you have to report them. So report them in the sense, like as a staff nurse, I can't go and report to the chairperson. Okay, so I have to go and tell my supervisor. From my supervisor, it has to go to the middle level management. From the middle level management, it has to go to the top level management. So that is the way of communication. So reporting. So you have to tell how many patients, OP patients today we had, how many inpatients we had, how many surgeries we did, so how many recoveries, how many transfer outs, all these things you will have a reporting. So reporting, again, this will not be done according to the level of management. So you have to proceed according to the your level of communication. So it has to proceed in a correct mode of communication. And then we have budgeting. So budgeting, you have to see adequately your ward is equipped. So in case if you don't have adequate pulse oximeters, if you don't have adequate ventilators, what you have to tell? You have to go and tell it in the supervisory level. From there, they will inform to the top level management, and from there budgets will be allotted. So budgets will be allotted according to the demand, according to the need. Okay, a lab will get an amount of budget, and a classroom will get a different amount of budget. So this and that will not be the same. So according to the need only budget will be allowed. Okay, so this is the areas where we are going to concentrate when we are talking about management. So your planning, organization, staffing, directing, coordinating, reporting, budgeting, all comes under the same topic of POSDCORB. When they ask you to write about POSDCORB in 5 marks, if you write this very sufficiently enough, you will get 5 marks. Okay, hope you understood the topic. So let us meet in the next class with some other topic. Till then, take care. Bye.